Nearly 250 new cases were accounted for in the last 24 hours, bringing the new global tally of COVID-19 cases to 27.6 million. Well, deaths are now 898,000, while recovery has gained more than 200,000, bringing the new total to 18.5 million. The United States remains the most impacted country in the world with 6.3 million cases. As it witnessed a flare in infection spread, India now has 4.3 million cases. Brazil still has a national tally of more than 4.1 million, while Russia and Peru retain number 4 and 5, with more than 1,691,000 national tallies respectively. This is COVID-19 Myths and Facts. Welcome on board. Now, contrary to its much publicized claim, the Federal Ministry of Health has corrected itself, saying it didn't receive COVID-19 vaccine samples from the Russian ambassador in Nigeria. Now it says the Russian Federation's ambassador handed over an aid memoir on the recently announced Russian-made COVID-19 vaccine to the Federal Ministry of Health. Well, the authorities on September the 4th, the ministry emphasized that after clarifications that what was handed over was to enable the Nigerian team study and get ready for further researches, patronage and application. The government says the Russian-made COVID-19 vaccine is still in the custody of the Russian Federation's embassy in Nigeria and not with the Federal Ministry of Health as assumed. Well, researchers have found that COVID-19 and antibodies that fight it can be in a child's body at the same time. And according to the director of laboratory informatics at the Children's National Hospital in Washington, D.C., Dr. Burak Boha, with most viruses, when you start to detect antibodies, you won't detect the virus anymore. But with COVID-19, we're seeing both. Well, this means children still have the potential to transmit the virus even if antibodies are detected. Well, Baha is lead author of a study that included more than 6,300 children who were tested for the new coronavirus and 215 patients who were tested for antibodies. And findings published on September the 3rd in the Journal of Pediatrics reveal that those 215 patients, 33 were tested for both the virus and antibodies, and 9 had antibodies in their blood and later tested positive for the SARS-CoV-2 virus. And Astrezeneca plc has put a hold on the late-stage trial of its highly anticipated COVID-19 vaccine candidate after a suspected serious adverse reaction in a study participant. We have details in this report.
The study is testing a COVID-19 vaccine being developed by Astrezeneca and University of Oxford researchers at sites including the United States and the United Kingdom, where the adverse event was reported. The nature of the safety issue and when it happened were not immediately known, although the participant is expected to recover. The report said suspension of the trial was having an impact on other AstraZeneca vaccine trials, as well as on clinical trials being conducted by other vaccine makers. Well, meanwhile, Britain's Health Secretary Matt Hancock said that safety was a priority. Mr. Hancock added that it was not the first time trials for the vaccine being developed with the University of Oxford had been put on hold.
Well, obviously, I'd rather this went completely smoothly. However, we're absolutely clear that safety comes first with the vaccine. So there's been a pause while they investigate an incident. This has happened before, and then the pause has been lifted. But it just shows how much of an emphasis we put on the safety of the vaccine, even though, of course, we're all desperate to see it work.
The AstraZeneca Oxford University vaccine is seen as a strong contender among dozens being developed globally. Hopes have been high that the vaccine might be one of the first to come on the market following successful phase 1 and 2 testing. Its move to phase 3 testing in recent weeks has involved some 30,000 participants in the US as well as in the UK, Brazil and South Africa. Phase 3 trials in vaccines often involve thousands of participants and can last several years. A final decision on restarting the trial will be taken by the medical regulator, the MHRA, which could take only days. But until then, all international vaccination sites in the UK, Brazil, South Africa.
Well, joining me now to examine the implications of this development is a public health consultant, a public health expert, that is Dr. Doyin Odubanjo. Good to have you on the program this evening. So now, what do you make of AstraZeneca's vaccine candidate being put on hold, even though that was done over safety concerns?
Well, it's important actually, and it goes to show that when you're developing drugs, vaccines, it's very serious business. Because one of the things that might shock people there is that they only had one person who showed the adverse reaction. But once you have significant adverse reaction, even in one person, then it calls for you to stop. It's a pause. You take a pause. You take a look at everything all over again to try to know exactly what happened and why that happened. Knowing also that you've had phases before this where you've tried to check for safety, apart from efficacy. So you've already tried to look for safety. There were even preclinical stages where you started from the lab to the animals before you came to humans at all. But no matter what stage in the development you find any unexpected adverse reaction, you have to stop and be sure of what's going on before you can resume, if you resume at all. The only other thing you worry about is that you hope that this does not bring to the fore the fear of some people that perhaps these processes are being rushed.
And that's exactly the point I'm getting to, Dr. Doyin. Apologies there. But, the vaccine is believed to be a strong contender among dozens other developed or globally. But do you think perhaps this latest development will affect a global acceptance of the vaccine? What are your thoughts?
Well, it would actually, to tell the truth, it would, because already there are people who are skeptical. Skeptical about vaccines at all to begin with, even old existing vaccines. The skeptic movement has increased in recent years, even in developed countries, with parents who don't want children to take vaccines at all. Not to talk of a new vaccine, completely new vaccine, and then to talk of a completely new vaccine being developed in an emergency situation, and therefore the process is being fast-tracked. So it does raise issues around acceptance, which will have to be addressed carefully.
So let's just look at the recent findings that COVID-19 and antibodies that fight it can be in a child's body at the same time. What do you make of this?
Well, it's like has been said in the report, that means that actually when you find antibodies, the real question you have to ask with antibodies are, does it show a recent infection? What level of antibody is sufficient to prevent an infection, that is a reinfection of that person? And what level of antibody guarantees you that that person cannot possibly be transmitting the disease? So those are still questions, really. Nobody has final answers on all of these things. There are still things that people are still working on, trying to find. So, for instance, people are asking, why are we not doing antibodies in the antibody studies in the community? It can tell us perhaps the scale of the infection in our communities, but it doesn't answer all questions. So it won't tell you if the person was recently infected 2 months ago, 3 months ago. You wouldn't know, but you know that, okay, this person has been exposed to that virus before, but again, how much of that do you need in order to guarantee that he will not be, he will not be infected again, or is not infectious to other people at the same time?
So if this means, apologies there, but if this means that children still have the potential to transmit the virus, even if antibodies are detected, what should be the safety rule now, especially as schools gradually reopen and teachers are expected in the classrooms?
Well, I would say that really the schools have to be careful. We all have to be careful. And I think that note of caution is being sounded. And even though we also have people who are just fed up and we just want children back in school and all of that, but we must know that a risk still exists. And as far as the schools are going back, I think they also have to take personal responsibility. That's the schools themselves. for their students and their staff. So they have to really examine the measures they are putting in place and be sure that those measures will be sufficient to protect both staff and students.
All right. Thanks a lot, Dr. Doyin Odubanjo, for sharing your thoughts with us on COVID-19 myths and facts. And that's our package on today's edition of COVID-19 Myths and Facts. Thank you for watching. Remember, whatever you do, stay informed and stay safe. Bye for now.